I'm Dr. Brendan O'Coughlin. I'm a consultant cardiologist here at the Galway Clinic, and my main area of interest is the treatment of arrhythmias. This is a subspecialty in cardiology called electrophysiology, which is the physiology of how you get an abnormal heartbeat, how do you get an arrhythmia. So I'm going to talk about palpitations. Palpitations are very common. And there are many different types of palpitations, and people mean different things when they say, I'm having a palpitation. Now, one type of palpitation, which is the most common, is where people say that the heart is skipping and jumping. In other words, that the heart is beating along normally and they get some extra beats. Now, if I show you here in a heart model, I can show you exactly what's happening. Here I'm opening up the heart and showing the two upper and the two lower chambers. The normal heartbeat comes from the right upper chamber to the right lower chamber as a wave of electricity, and the heart beats. This happens 60, 70, 100 times a minute, and as you walk faster down the road, the impulse generation rate speeds up to maybe 120 beats a minute when you're exercising. Now, all of this muscle down here in the two lower chambers can, under certain circumstances, generate a heartbeat. So what happens is, you generate a heartbeat here and it goes bump, bump, and then a beat is generated here, and this spreads, instead of spreading from top to bottom through the heart, it goes from the bottom to the top through the heart, and what it does is it resets the heartbeat, like a timer if you were playing music, for example. So you'll have a normal beat, a beat comes early, this will cause a pause, and then the next beat comes later. Because it comes later, the heart is filled with more blood, so it'll be an extra strong thump in the chest. People feel this as a wallop in their chest, often going up into their neck. Some people can say it takes their breath away. Now, other people may not even feel a thing and be unaware that they're even skipping beats from time to time. So an extra beat, or a PVC, is the other terminology, a premature ventricular contraction. It just means that a piece of muscle in the lower chamber fired out of turn instead of coming from top to bottom, and it generates a heartbeat which resets the normal timer of the heart, and it can cause a thump in the chest. These typically occur when you're lying down in bed, when you're sleeping, because as your heart rate slows down at night, other spots in the heart can suddenly start firing for no apparent reason, and you may feel most thumps when you're lying in bed at night. In another situation, sometimes they're driven by adrenaline. So when you go to exercise, play sports or go running, you may feel some thumps in your chest, because in a small minority of cases, the areas of heart muscle here are triggered by adrenaline, and that causes the thumps to occur with exercise. These are normally entirely benign. In other words, they're not a cause of sudden death. They typically occur actually in people with normal hearts, although they do also occur in people who've had a heart attack or who've had heart failure. So if somebody says they're having palpitations, how do we investigate it? Well, we will do an ultrasound of the heart, which is like an ultrasound you might have when you're pregnant, to look at a newborn baby, to look at a baby in the uterus. Instead, we're looking at the heart, so we want to see that the valves and the chambers of the heart are normal size and are working normally. If that's the case and your exercise tolerance is normal, we know these skipped beats are entirely benign. They've been studied in airline pilots now for over 40 years. A second type of palpitation is where your heart suddenly starts racing. In other words, your heart is beating along normally, maybe at 60, 70 beats a minute, and suddenly will race at 200 beats a minute. This is a completely different situation, and we often call it an SVT, or supraventricular tachycardia. What that means is it's a heartbeat from the two upper chambers of the heart as opposed to one of the two lower chambers. The normal electrical sequence in the heart is that electricity goes from the heart's pacemaker, which is an area of tissue in this upper chamber of the heart. It spreads down through the middle of the heart and innervates by little nerve-like structures through the two lower chambers, and the heart beats. Now, the heartbeat can only go from top to bottom of the heart. In a percentage of people, about 1 in 1,000, there's an extra electrical pathway crossing one of the valves. See, the valves are electrical insulators, so electricity can go through a specialized pathway from the top to the bottom of the heart, but it can't come back up. If you have an extra pathway, the impulse can go from the top to the bottom of the heart and then come back up, and you have a racing circuit developing. This can start in a second. In the flick of a switch, the heart can go from 60 beats a minute to 160 beats a minute. Equally, it can suddenly stop. Usually how it starts or stops is you get a skipped beat, an extra beat from one of the the lower chambers of the heart, in this area of heart muscle, and it fires at a certain time in the heart cycle. The impulse will go up. Will go up the extra pathway and trigger what we call a re-entrant circuit, so the heart can race. This is something you're born with. Now, it may start causing trouble in childhood, or it may happen in your 60s or 70s, but it has a typical feature. It starts suddenly, it stops suddenly, and when it races, it is totally regular. There is no irregularity, there's no skipping or jumping. It is as regular as clockwork at 160, maybe even 200 beats a minute. This sort of arrhythmia can last for minutes or even hours. It doesn't cause sudden death. It is a major nuisance for the person who has it. Nowadays, we have a way of curing it. We can either first treat it with medicine to try and stop you having it. Unfortunately, like a lot of medicines, there are side effects. So an easier way to treat it is to put a catheter into a vein in your leg, into your heart, and we can actually find the wire, the extra circuit where it goes from the top to the bottom of the heart. The catheter has a cautery tip the size of the tip of a biro, and we can cauterize a pinpoint spot, and that will cure the arrhythmia. That accounts for all of the cases essentially of SVT. There is an extra circuit either on the right hand side of the heart or crossing the mitral valve on the left hand side of the heart.